Hepatitis-B is a potentially life-threatening liver infection, and it can put people at high risk of death from cirrhosis and liver cancer. It is mainly transmitted through exposure to infected blood or bodily secretions, including through sexual contact, though in most cases it is transmitted during childhood.
The population we really have to concentrate on are our children and our babies. So please make sure that your babies get all their shots of hepatitis B vaccine. And because once you have got hepatitis B, we also have got treatment to reduce the risk of cirrhosis, liver cancer, chronic inflammation, but we will never eradicate it totally.
44-year-old Lihongeni Neronga was diagnosed with hepatitis B about 4 months ago, becoming part of the 18% prevalence rate among people with hepatitis B in the country. It began with her legs swelling, and later her stomach too began bloating, primarily due to liver damage. When one's liver is damaged, there is increased pressure on the liver blood vessels, which causes significant fluid buildup and swelling in the abdomen, which she now has. She visits the hospital once every week for the fluid to be drained.
Most likely in this case, the inflammation has progressed to something that we call cirrhosis, which means scarring of a liver that isn't having the normal structure anymore, healthy tissue. It's basically full of fibrotic tissue, and blood can't flow freely through it, and it doesn't function normally anymore.
This has limited her movement and makes it impossible for her to work for an income to improve her living standard, which is not so pleasant.
The swelling of the body has gone down. The stomach gets smaller when they drain the water, but it's still swollen, and my heart is no longer beating fast as it used to be. The only problem is that I cannot work or walk around even to fetch water. I'm surviving from other people sometimes. They also give me $10 or $20 to go to the hospital.
Hepatitis can be treated, and one option is a liver transplant, but specialists say this can be risky.
I don't think anybody should have hope for a liver transplant in hepatitis B, because you can get reinfected, and once you get a liver transplant, you need very severe immune suppression to prevent the body from rejecting the new organ, and usually then you're prone to new viremias. You can really never get really rid of hepatitis B. So no, it's not an option.
Most people do not experience any symptoms during the acute infection phase, but others may experience acute illness with symptoms that could last several weeks. This includes yellow of the skin and eyes, dark urine, extreme fatigue, nausea, vomiting, and right upper abdominal pain due to the inflamed liver.